HIV testing, generally there are various ways we can do it. It's a blood test. So you can have, so if it incorporates a blood test, it is generally one of two things. So the third generation tests are the older tests. They incorporate ELISA or just antibody testing. So HIV antibodies generally take about maybe 4 to 6 weeks to appear in the bloodstream. And so therefore, if you've been exposed to the virus, we would often take a blood test at baseline, but we would recommend that they repeat that outside that window period. The window period that's often quoted is 3 months, because some patients may take more than 6 weeks, but in reality is they generally would have produced the antibodies by 6 weeks. So that's the window period of the third generation test using just HIV antibodies, the ELISA test. Nowadays, and most places are able to offer fourth generation antibody tests, and those are tests incorporating HIV antibodies combined with a P24 antigen. And so what that does, it reduces the window period to about 4 weeks. So if a person has been exposed to HIV, then they would be tested at baseline, but then they can now come back after 4 weeks to repeat the test to ensure that they have not acquired the virus. Okay, so that has actually improved HIV testing considerably for those who have been exposed, and reducing anxiety in those patients. Now, testing, of course, the most sensitive indicator of HIV infection, of course, is nucleic acid amplification tests, or NATs, or actually testing for the HIV virus itself. So the problem with that is that it is a very expensive test, and so we don't often use it as a baseline to test patients. And that is often used in the setting whereby patients have already been found to be ELISA or antibody positive, and you need a supplementary test to confirm that yes, they do indeed have HIV infection. It is the most sensitive indicator because you're relying on bits of DNA of the HIV virus, but we only tend to use it after they have been found to be antibody positive, or if they're on HIV treatment, we want to see whether they're responding to treatment, or in circumstances as I mentioned previously, they've presented with very early HIV infection, and their antibody tests have not become positive as yet because they're still within the window period. The only test that would pick up HIV infection at that time is a HIV nucleic acid amplification test. So rapid testing is basically, it's an immunoflow assay test, if I can say that correctly, whereby they use finger prick blood, which is then placed on a strip, and then you wait for about 15 to 20 minutes, and if a line appears, then the test is positive. It uses the same principle behind ELISA testing, so incorporates basically antibody testing. So it's using third generation tests. So that needs to be taken into account because the window period there is longer than some of the newer generation tests. Patients like it, of course, because it provides an answer very, very quickly on the same day. And you can leave the clinic knowing your HIV status at that period of time. So it's used a lot certainly in field work and in outreach work, whereby you want to test patients and they're unlikely to return back for results. But really, once again, it should be scaled up because even in centres which offer, even in, let's say, primary care clinics, because it's very satisfying for patients, to know their status there and then.